All right, folks, welcome to the Fitness for 55 Plus podcast. My name is Dr. Dustin Jones. I have a very special guest today, Ann Shaw. How are we doing?
Great.
Ann, tell me a little bit about yourself. How long have you been a Stronger Life member? Just a quick intro so they know who we're talking to. We're going to be talking about all you need to know about knee replacements. Ann has a really cool story, so just give me a little background.
Well, coming up on 2 years in Stronger Life. I started Stronger Life shortly after hip replacement.
Okay.
And I was very anxious.
I remember.
And very tentative about what I was doing. But it was great. It was when we were in the Maximus building. And I just have fallen in love with what Stronger Life is all about.
Yeah.
So then fast forward to now, had a knee replacement just over 4 months ago.
Yeah.
And I worked really hard in the months prior to that. I mean, I really pushed myself, coming 4 and 5 days a week to try and get as fit as possible with the muscles and balance and all that, because you have to do a lot of lifting with your arms as well.
Yeah.
So now we're here.
Now we're here. And now it's in your rearview mirror, and it's like you never had it. In
well, I don't know if I would go that far.
From the outsider perspective, it can seem like that.
Well, thank you.
So we're going live in our Fitness for 55 Plus Facebook group. So for those that are listening to the podcast, you can get inside this group. Inside this Facebook group, we've fielded questions from the members about knee replacements, and we're just going to ask Ann, because I've worked with a lot of folks from the rehab angle in the hospital, in home health and outpatient, and then in the context of fitness here at Stronger Life. But it's way more valuable to hear from someone that's actually been through it on the receiving end and what that means. So we've got lots of good questions from our members here. And so the first one I want to start with is what was the journey up to making the decision that you wanted to get a knee replacement? Because a lot of folks are experiencing that, right? Like, especially that are watching or listening, that they may have some type of knee pain. It may start to limit their lives, and they're having to face this decision. So kind of how long were you having knee pain, and then what was that point where you said, all right, I'm going to let them cut on me and replace that joint? What was that journey like for you?
Well, I think it really started to be noticeable when I was traveling, being a supervisor on some high school trips to Europe. And that was probably back in 2016. Okay,
so 4 or 5 years before joining Stronger Life, you started to really notice it.
Right, and it was when you're in Europe and you're going up and down those very steep cobbled roads. I did take some like stretchy support knee braces, and those really helped a lot. But I had to be very careful even then. I did have a lot of pain at night, and sometimes it would keep me awake for hours and hours. It was behind the knee, which is kind of interesting. So I think that a lot of the muscles were working to do more than they normally would do if the knee was correct. But I had severe arthritis in the knee. It wasn't a result of an injury. And it got to the point, well, I did some injections, did 2 injections, and then after the second one, they weren't working anymore. They had such a short-lived life. And so I decided I better consider next steps. I work in the yard a lot. And
I'm grateful for that, because we get a lot of benefits from that when you bring in some of your extras from your garden.
Yes. We have a very large yard, and I love gardening. And I just noticed that I had to be very aware of where the divots were in the yard. You typically are anyway. But if I hit one of those, it could have been really bad. I did have a few falls because my balance was not as strong since my left leg was having to compensate so much. None of them ever caused any other injury other than, knock to the crazy head.
Yeah. That explains it all.
Yeah, it does.
I'm kidding.
But I was not being able to do the things that I wanted to do. Mm-hmm. When we went to Alaska, it was difficult for me to do the hiking, and I love hiking.
Yeah, that was last
year.
What? Okay,
in
was
June.
That summer, June of 2023.
So I decided to go ahead and bite the bullet, get it done in September. Mm-hmm. As far as daily pain, I guess it would come and go. Sometimes it would bother me, sometimes it wouldn't, and then sometimes it would be horrible. It would click all the time. Going up and down stairs was treacherous.
Yeah.
So I'm sure I need to repaint the wall at home.
Hold on.
So does that help?
Yeah, no, that's helpful. What was it like coming here to Stronger Life with that going on? Because we do a lot of leg-based exercises. We provide a lot of options, right? Like, so you can do what you can despite a limitation or an injury. But you had the hip replacement. You joined the gym. You were very active, and you were still getting really strong and seeing amazing results despite having some of those issues. What was that like, continuing to work out regularly when you had that pain with your knee?
Well, coming to the gym helps me feel like I'm normal. Mm. And that was one of the things that I celebrated when I came back from the knee replacement. Yeah. Was, okay, I'm back. Yep. And it was a real celebration. It really was.
Yeah, for everyone that saw you, too.
But what was the question?
Just like the day in, day out, coming to the gym when you have that knee pain. Like what were you doing in class, to make sure that your day wasn't ruined, for example? Like,
well, I always protected my knee.
Yeah.
And but I would still push. Mm-hmm. Because as I was leading up to the day of surgery, I wanted to be the best I could be. Yeah. To be prepared. I will admit I carried ice in the car for after we had workings. Mm-hmm. I would put it on because it had Velcro, and so I would use ice right after class every time, and then go home and elevate it. So you make adaptations. Yeah. But any movement is better than no movement.
Yeah. Yeah, and for those watching or listening, if you caught episode number 4, number 5, we talked about pain, we talked about when to rest, and in those episodes we talked about the very few occasions where you may want to stop moving, and it's very, very rare. And I think Anne's, like, her story is really pertinent for a lot of folks, because you may want to stop doing activity or want to rest, but you can modify, you can work around, and you can still come and be active and get as fit as possible. And for a lot of people, it will take their pain away. Not everyone, but there are folks that come in with knee pain that don't have knee pain anymore. There's folks that have knee pain that still have it, but they're still fitter as a result. They're stronger, their endurance is better, maybe got off some medications, improved their A1C levels, all these different benefits. But I think how you handled yourself before and after surgery, but definitely before, like, you really did yourself a favor by continuing to come, when it would have been very easy to just be like, I can't do anything, right? But there's a lot that you still can do. So now let's get to the surgery and the experience of going into it. I'm going to link to, we did a blog post that when you shared all that information in our members Facebook group, we did a blog post basically sharing all that with folks. And I'll link to that for those watching or listening, because you just took all your notes from what you wish you would have known before the surgery and after. So what was the experience like, kind of going into surgery in those few days right after it happened?
Well, Dr. K knows my personality. Yeah. And he said, Anne, this is not going to be like the hip replacement.
Yeah.
He said it's going to be a long-term recovery. And it is. You know, here I am past 4 months, and it's still a daily part of my life.
Yeah.
I get up, I stretch, and all that kind of thing before I come here. So as far as the surgery, of course, I was really anxious. But I remember coming to Stronger Life like the day before the surgery. And my favorite things are slam balls. And so I really just use slam balls to get rid of my aggression. And so I was out there, you know, when I would slam the ball, I would do it hard. And I would think about my blasted knee.
Bye-bye knee.
And so that made me feel good, and it got rid of some energy. So you need to have a fun physical way to get rid of that anxiety before the surgery. It was an in and out surgery. I did not have an overnight stay. And Dr. K, of course, is amazing. Let me just say that. But it was really hard. The first day, the nerve block was still working. So it's not too bad. The second day, it became more interesting. So I think the surgery was on a Friday. Saturday was interesting. Sunday was horrible. It was absolutely horrible. I had not felt that much pain before in my life. But the good news is that that intensity of pain was short-lived. And I just had to learn how to move and work with my leg in its new capacity. Somebody said to me when I visited Stronger Life before my return, "Would you do it the other knee?" And I said, "I don't know."
At that phase of
the
recovery.
And I'm still not to full recovery at all. I continue to work on the bend and the straightening. I have gotten it straight to 0 degrees. And I still do those exercises to maintain, because apparently I'm told that for the first year, if you don't continue those stretches, you can regress. I always work on the bend. I do have difficulty with that. I'm at an acceptable level, but I didn't realize before surgery that I would not get the full range of motion bending as I had before. So that was a bit of adjustment. But I must say, when I went to physical therapy and I said, I want to practice getting on the ground. This was at about week 2.
Because this is outpatient?
Outpatient physical therapy. I said, I want to get on the ground because I feel like doing the exercises on my bed is causing more problems for my back, and I needed a solid surface. And so I did it supervised with the physical therapist. And
which was that?
Court,
Laura
Williams. And she was really amazed at how easily I got up off of the floor. And it's because of all the work here at Stronger Life.
You get lots of practice.
Yes. You know, the up downs, the planks, all of that. And my body knew what to do. So, you can't just think about exercising the leg. You have to think about exercising the whole body so that after surgery you're ready to go.
That's especially, like you said, the upper extremity part. There's so many benefits to getting as fit and strong as possible beforehand to that. So,
I did think I was going to get better faster, though, I must say.
The knees are tough. I mean, for Sue Westerman, she's watching right now, she said, this was my thought after my first knee. Then the pain on just walking got to the point I knew I needed to do the second knee. Big difference in the two, and I'm so glad I did. And just people's experiences with knee replacements vary so much.
Absolutely.
Right? But what's tough, particularly for your situation, is you had a hip replacement first.
Yes.
And hip replacements are so much, the recovery is so much nicer than a knee replacement.
Yes.
And it's very easy to go into knee replacement having the same expectations, and it's night and day difference.
Yes, it is. You do need to be dedicated with your exercises.
Yeah, regardless,
because
for sure.
In that period after the surgery, I felt like all I did was get up, go to the bathroom, eat, well, sort of get up.
Yeah.
Exercised because I had a RomTech bike,
Yep.
which was something new that Dr. K was trying out, which I loved, and Medicare paid for that.
Yeah, which is basically like a recumbent type bike. You're sitting and it's moving, and so your knees bending and straightening.
And so I would do that for 20 minutes, 4 and 5 times a day.
Yeah.
And then I would do my exercises 4 times a day.
Yeah.
And I felt like my life was exercise. And so I just told myself, exercise is my job right now. And to be the best me I can be, I need to do my job regularly and be dedicated to it.
Yeah.
Because in the first few weeks, there's a window of time that is critical right after the surgery where you can make your most gains.
Yep.
And that's not to say that you can't continue to make gains, but it's my opinion and some of the things that I have read that you need to make the most of those first 6 to 8 weeks. And so that was the carrot that I put out there for myself.
And that's huge. And it's the tough part about that is that 6 to 8 week phase is also the most painful. And so it's very easy to not push your range of motion. And for some, ideally we're trying to get it straight as quickly as possible, and then we worry about the bend.
Right.
But the more range of motions you can get in that window, it just makes life a lot easier. But if that knee gets real tight, you don't have that bend, it can't go straight, and you're talking, weeks upon weeks upon weeks after that phase, it brings up a lot of challenges for individuals.
So I would say if somebody is not willing to commit to recovery being their job, maybe they are not the best candidate for a knee replacement.
Yeah. Yeah. And we'll see that as physical therapists too, for sure. Susan said, yes, I started outpatient physical therapy with Jeff the Monday after my Friday surgery. And so, in some folks, they will, depending on their mobility, how well they get around, some folks may stay in the hospital, some folks may get home health, so therapists coming to them in the home, and some may go straight to outpatient, which for you, having Bob was huge for that.
I cannot say enough about my husband. He was changing ice. I got an ice machine. That's something you should get. And that's going to be in the link that you're going to provide.
Yep.
But his patience, him not being judgmental and not trying to say, oh, it'll feel better soon. No, it's not.
Yeah.
It feels like crap.
Yeah.
And he was just always there. And I'm so thankful. So if you really need to have somebody that you can count on, because in that relationship you don't need it to add stress.
Yeah.
Because it's already a tense enough situation, and when you're in pain you tend to, not respond normally. But there was one day, it was on a Sunday afternoon, it was the third day. I moved and just let out a blood-curdling scream. And Bob was in the room, and I could see the pain that it caused him. And right after that, my 2 boys came over to visit, and he said, I'm out for a while. And he just needed
Tapping out.
tap, you're it.
I love it.
But The pain does get better, but it is very intense at the beginning.
How are the medications?
I've been on meloxicam for some time, and that is an anti-inflammatory that helps with the arthritis. And I continued that, of course, after surgery. I think that's a really good one for me. Your doctor, of course, is the professional, knows what you need. I used some of the more serious, I don't know, oxycodone or something, or Percocet, one of those, for less than a week. And I don't like those. So I stopped those as soon as I could and relied as much as possible on ice. Ice is your friend.
And that's a tricky situation too, because what I would find with a lot of folks that I worked with, and this was more when the opioid epidemic was a more front of mind conversation. It's still an issue, obviously, but there's a lot of stigma around any pain-related medication, and so a lot of people were avoiding their medication after surgery. And that short window, like you mentioned, where it's extremely painful but super vital to get as much range as possible, we'd have people completely avoiding meds, so we couldn't do therapy, and that's not good. So it's like, if that pain is limiting you from being able to do your therapy, you should take it. But I definitely understand the apprehension or wanting to get off it as soon as possible. It's a really
with pain
scenario.
Medicine, it's so important to stay ahead of the pain cycle. And so you can't just take one pill and expect it to be wonderful. You have to stay ahead and be regular in taking the medicine so that it doesn't creep back up, because it's really hard to get it back contained afterwards. It's what my experience has been.
And timing it with your exercises and things along those lines. All right, so we're at outpatient physical therapy. We're with Laura Williams. We love Laura Williams here. She's an amazing physical therapist.
She's incredible.
That's very fit individual, very strong, but she understands what we do here, and she's done a great job of helping so many of our members get back into the gym as quickly as possible. So you're in outpatient, and you're starting to think about, all right, when can I come back to Stronger Life? What did that kind of rehab look like as you were approaching the decision, okay, I'm ready to go back? What did those sessions look like for y'all?
Well, they got more and more intense and more weights. But I was determined. I think I came back just after 8 weeks. And it was not easy. But the boost it gave to my confidence, and we talk a lot about confidence and how important it is to not falling and to believing in your body. If you're tentative with your body, you're more prone to have an accident. So it was much more intense and a lot more weights is what I used the sled some, lots of squats with weights.
Things on your feet, more functional activities, and early on.
Steps.
So early on, it's a lot of straightening the knee, bending the knee, a lot of exercises maybe in sitting, some in standing, but as it progresses, you're doing things that you're doing here, basically. So 8 weeks out, you're like, all right, I'm ready to come back. What was that transition like, going back into your normal routine, and what things did you do differently, or what was on your mind as you're coming back here?
I was really amazed at how well I did when I came back, and that's not to brag or anything. The thing that then and still gives me difficulty is the amount of bend in the leg. So like today when we were doing up downs, I will start using the box, and now I can do some rounds on the floor, but to get the right leg to bend is a little tricky to the level I want, because basically you bend, then you push up, and all your body is being raised on that one leg.
Yeah.
So the leg, the marches today, for example, eyes closed with weights.
Of course.
So those were, I can get it up pretty well, but I can't meet the left side.
Yeah.
So each day is different, and you just have to listen to your body, and some days are going to be better than others, and those days are great.
Yeah.
Because they fuel you.
Yeah. Yeah. That's awesome. Do you have an ice pack waiting in your car?
I don't need that anymore.
Okay. So pain's better?
Yes.
Yeah. So you had some fluctuation day to day, but overall, pain's a lot better than...
Pain is a lot better.
Yeah.
Well, let's say lack of pain is a lot better.
Yeah. All right.
It's not that I've gotten used to the pain.
Yeah.
Now, one thing I thought was very interesting that I never really thought of is your knee area feels numb for a very long time. And it's kind of like when you go to the dentist and you have that numb kind of thing. It's like you're touching it, but you're not feeling it. And I still have a bit of that. And it does help, I think, to rub the leg.
Yes, it does.
Even now. And I just think that was something that was unexpected, really.
Yeah, and that really that can be very impactful for folks if they don't do what you did with Laura relatively early on, where you got on the ground. So if people are not regularly kind of stimulating that area, rubbing it, or even bearing weight on it, you stretch that out over months, over years, you lose confidence that you can do that. You're very fearful of doing that. And so exposing that area to pressure and rubbing on it can desensitize it. And so what we would see is a lot of folks will be scared to death to bear weight on that knee for that reason, but then also thinking that knee replacement can't handle that type of pressure, which it can. So yeah, you bearing weight and being on your hands and knees, working on getting to and from the ground, that helps with that tremendously in the terms of desensitizing it.
Yes.
But you will get that back. It just takes longer for for the nerves to heal. But it'll
well,
come.
And I have adjusted it in my mind that it is a year journey. And while the celebrations are not occurring as frequently, and I really made sure to celebrate when something new happened in ability, it's still a celebration to be alive and to have the incredible doctors and physical therapists to help on that journey.
Yeah.
But don't go in thinking it's short.
Yeah, it's not short.
No.
It's not easy. I want to make sure I get to a few questions from the Facebook group. So Kathy Watkins, what's up, Kathy? She asked, how quickly should I expect to return to Stronger Life? You came back in about 8 weeks. We talked about what the rehab journey looked like up to that point, but she asked, how will I know? Do you remember a moment when you knew, okay, I can do this? Or was that in the context of Laura challenging you in physical therapy? When did you know, all right, I can get back here to Stronger Life, or an exercise program for those that aren't
I just decided myself I had a date.
Yeah.
And, I'm very big about goal setting.
Yeah.
So I was determined I was going to be back with Laura's blessing at 8 weeks. And I would do the best I could, because that's one of the benefits of coming to a gym like Stronger Life, is that we do have accommodations.
Yeah, and we honestly didn't have to make many for you at 8 weeks, but we we can.
I do remember the first day we had the rowing machine. That was interesting.
Yeah.
But it was the first time that I did it, and my knee just basically, what? And so I knew not to go that far anymore.
Right. You just shorten it up.
Right.
Yeah.
So you just have to listen to your body.
And we got you, Kathy. We got you. We can definitely modify. Kristen had some good questions. Is your strength and mobility the same, better, or worse than it was before the surgery? So we talked about the mobility. You're still working on that to be equal to your other side. But when you think about the strength, do you notice differences left to right at this point in terms of one side being stronger than the other?
I think so, but part of that is because of the focus that my body had in protecting the right side.
Yeah.
And, it takes, I was really surprised at how quickly the muscles deteriorated. I don't know if that's the correct word, atrophied.
Atrophy, yeah, but they basically waste away.
Right.
Yeah.
And I was really quite shocked because I knew that I was in good shape going in. So I can only imagine if you aren't in good shape and you have even further to go.
Yeah.
So no, it's not where they're not equitable, but they're acceptable.
Yeah.
And they will only continue to improve.
Yep. Yeah, especially when you're as diligent as you are with coming to here, but then also you're still doing a lot of knee-specific exercises from physical therapy and whatnot. So,
so when you graduate from physical therapy, you don't graduate.
No, you never. It's like brushing your teeth at this point. Kristen also asked, how long can you stand and walk since you had the surgery as compared to before?
I don't have any issue with that.
Yeah. That's awesome.
Now, I did 5 weeks ago. Like around Christmas time, so that would have been September. At 2.5, 3 months. It was really, really a challenge for me to go into the mall and get something and come back out.
Yeah.
And so, Amazon, here we come.
Yeah.
So I accommodated. But so you think that at about 2 months, you're still having to struggle with your, ability and strength. Because I thought, I'll go walk at the mall. No.
Yeah.
It was walk into the store and come back out.
Right. But now you can handle
whatever.
that just fine. That's awesome. And I think you're about to have another test coming up in about 3 weeks where there's a bunch of us going to the Dominican Republic for the Stronger Life Adventure Retreat, which is going to be incredible. But that'll be a good test for your knee too, which I have complete confidence it'll be just fine.
Yes.
The all you can eat food drink is going to help as well, I'm sure, in that regard. But yeah, no, this.
Now I want to say one thing that I didn't realize was, as a result, I guess, of the anesthesia or, I don't know, pain, I didn't have any appetite after the surgery. And Bob kept saying, you need to eat. You're not eating enough. You need to eat. And I knew I needed to, but I didn't. It wasn't like I was nauseous or anything. I just wasn't interested.
Yeah.
Now I lost 20 pounds.
20?
20.
Man.
So it's not a weight loss strategy.
Don't recommend that. There's much better ways.
But, it did provide a nice bonus.
Yeah, and I've had a lot of folks, and we don't have to get into this with your situation, but early on of having issues with constipation, bowel movements, those types of things where they're getting really uncomfortable, that can influence their appetite as well. But that's not everybody for sure. So, well, awesome. Thank you for sharing your story with us. I think it's cool from a coach's angle to see, well, like when you started, like right after the hip replacement, and just how timid you were about your hip when you started, like you said, and just as that changed, it's just like you're a whole different person. And then you go into this surgery as fit and strong as possible, and then you just recover really well. and you're not the only one. Like Sue Westerman's on here. Like
Right.
she
And she really helped me. We
Yeah.
talked before the surgery and all. But I guess, when people say, how did you know when it was time? Which we get back to the beginning, basically. Ultimately, our bodies get used to pain. And your tolerance, well, I do, I know. I imagine other people do. You get used to it. And so it continues to build. And so you don't realize it's as bad and that it's impeding the things that bring you joy. And so sometimes you might not know it's time, I guess is my point. Because you get used to that being your new normal.
Yeah.
But it doesn't have to be.
Yeah. Man, that makes me think about just so many stories that we hear here at Stronger Life of dreams, aspirations,
That's
hobbies
it.
that want to pick up.
That's it.
That they may have the confidence to do now or the ability to do now. That if you are losing that that not necessarily drive, but just thinking that that's a possibility, right? Then that may be a good time to consider.
Yeah. I think one thing that we discover as we get older is time is finite. And we want to make the most of it.
Yeah.
And my battle is I want to be the best me that I can be for as long as possible.
Yeah. Yeah. I love it. Thank you for
Certainly.
sharing. This is really helpful, and I know it's going to be really helpful for everyone watching, listening. If you're watching in our Facebook groups or on YouTube or you're listening to the podcast, I will link to the blog post that I mentioned that Anne basically shared her whole notes of what she wished she would have known beforehand, what equipment she got, links to all that stuff, and then tips on kind of that recovery process. You wrote that, it was only like a few weeks after you're out of surgery, I think.
Well, I would
shared that.
I would add to it every day.
Yeah.
And because I thought, so many people at Stronger Life had asked and been curious and were very caring, about it, that I thought, this would help a lot of people.
Yeah, and it did, and it'll definitely help folks to watch that. So you'll get a link to that, so be sure to read that if this is something that you're curious about. Also, if you have any other questions about knee replacements, hip replacements, drop them in the Fitness for 55 Plus Facebook group. That's where this live stream is housed. That's where Sue Westerman's asking questions, Kristen as well. So you can get in that Facebook group and ask questions, and we'll do our best to answer them. But thank you, Anne. Thank you, Bob, as well, for
Bob's
helping you get to this
amazing.
point. Dr. K, Laura, it definitely takes a team. Appreciate y'all for listening or watching. All right.